So let's talk about care for our loved ones after chemotherapy. So if you have an opportunity to be able to go home after your chemotherapy infusion, so you're getting outpatient, which is kind of nice to be able to stay at home and spend time with our loved ones. You might also be thinking about how you can prevent exposing your family members, especially if you have kids or pets, to the chemotherapy drug you're taking, right? So we can talk more about that. So this is true for infusions. So that is the chemotherapy drug is given to you in your veins. So usually that can stay in your system for up to 48 hours or max up to 72 hours usually. So you want to take these precautions for first 2 to 3 days after you get your chemotherapy. Okay, so we've talked about what you need to do for yourself, which is you need to hydrate a lot and have really good hygiene in terms of washing your hands and cleaning yourself really well when you go to the bathroom. Let's talk about what you can think about when you're sharing space with your family members. Okay, so let's first talk about sharing the toilet. So if possible, try, and it's nice if you can have your own toilet that you're not sharing with anyone for the first 2 to 3 days, but it doesn't have to be the case. You can share, and that's fine. What you can do is when you're using the toilet and you flush, then put the lid down. So what this will do is, if the toilet has the lid and you put it down, when it flushes, then the particles are not going to go up in the air and spread. Okay. Also, it's a good idea to flush twice. So if all the chemotherapy drug that might have come out in the urine or in the feces, it's not removed in the first flush, then it can be taken out in the second flush. So that's another good idea for a toilet. And then one more is, whether you are a man or a woman, it's a good idea to sit on the toilet. So basically to prevent spraying, so that everything is contained in the toilet bowl and it can be flushed down. Okay, so if you have a good aim, fine, but just try not to splash and spray when you go to the bathroom. Okay. Now if somebody is incontinent and you're using undergarments or diapers or sheets, so it's good to put these in plastic bag, separate bag, and dispose it off separately from other things, so not to mix. And also, if you have sheets which might be soiled, then wash separately and wash twice if possible with hot water, because hot water helps with cleaning more of the germs. Okay. Let's see what else. Also, if you are taking care of someone who has cancer and they're getting chemotherapy, then you want to be careful about being in contact with bodily fluids. So it's a good idea to get a box of gloves. You can get it at any of the medical pharmacy stores, and use a fresh pair of gloves if you're going to be coming in contact with any of the bodily fluids. Okay, and wash your hands well. With soap and hot water, and I mean like warm water. You don't want to burn your skin every time, right? Okay, let's see what else. The other thing is there might be slight amount of drug that can be passed through saliva, so be careful when you are sharing food or drinks with someone. So you know, using your own plate and bowl, and if you wash it in the dishwasher with hot water, that's fine. You don't need to keep a separate plate and bowl for yourself, but just be a little more mindful in terms of sharing your cups and bowls, so that you're not the saliva is not coming in contact. And that also applies to intimacy. So a peck on the cheek is fine, a little bit of a kiss, small kiss is fine too, but deep kissing with tongue action where your saliva is being shared, you might want to wait for 2 days to do that. And also for sex, it's a good idea to use condom or sexual protection for those first 2 days, because there might be some elements of the drug in the semen, and you don't want to expose your partner to that. Okay, and that's it.